Hello everyone, this is Harsha and today I'm with the well-renowned Dr. Shailesh Hadgaonkar from Sancheti Hospital. The first question that I have was when can my uncle bend and sit after a surgery?
Thank you, Harsh, for this wonderful opportunity to connect and interact with people. I think bending and sitting, they are two different things. I will prefer the patient after the lower back surgery, they should avoid for at least 3 to 4 weeks. Slow bending in the knees is whenever required, but otherwise avoid much of bending. And sitting also, I normally recommend less of sitting. Walk you can do, walking is fine. And sitting on the floor, I will definitely not recommend for at least 4 to 6 weeks. That's not good. Initially, after surgery, there are 2-3 layers of things which we have to go through in the operation. It takes time. I think giving time at least 6 to 8 weeks is important in this.
Right. And sir, my uncle lives a very healthy lifestyle and he's independent in that term. So when can he start riding? When can he start driving again?
That's a good question, Harsh, again, because that's a question in everyone's mind. When I can go back to my small work, if I want to do by my two-wheeler or a four-wheeler. And normally we don't recommend it for at least 3 to 4 weeks till he is really comfortable. Two-wheelers, at least 6 weeks I will recommend we should avoid because sometimes you can have some pain and that can give a problem to you. 4 to 6 weeks in general we should avoid these things.
Okay. And sir, as my uncle leading a very active lifestyle, how soon can he resume back to his fitness regime and workout?
Yeah, that's again a very important question for a lot of people who are active in their lifestyle. I normally recommend walking from day 1 or day 2. Walking is one basic and important exercise. But at least 3 to 4 weeks they should do simple general exercises which are taught by the physiotherapist to them after their surgery. Like someone with a fusion surgery will need some different sets. Someone with simple decompression surgeries will need a different set. The 4 to 6 weeks is the minimum time one should allow, and then they can go slowly to their fitness regimes. That's normally recommended after the lower back surgery.
Right. And sir, in terms of a faster recovery, what is the suggested nutrition that my uncle should intake?
Yeah, nowadays a lot of people are talking very high about various medicines, supplements, Ayurvedic, herbal things. Normally, we prefer some vitamins for 2 to 3 months time for general recovery, antioxidants for those who need, some good healthy proteinaceous diet. Normally, we recommend for patients with some infection or some other issues. But in general, you should maintain and continue your healthy lifestyle. Avoid more of spicy food. Junk food we should avoid so that you can maintain a good healthy weight. And those who are diabetics or those who are overweight, they should avoid sweets. And salt also should be restricted in the food for at least 3 to 6 months.
Right. And sir, after a surgery, when does my uncle or when does anyone generally come back for a follow-up or an MRI scan, or is it required?
No. Normally MRI scan is not required for most of the patients unless we are monitoring some infective process or something. Otherwise, it's not required. We normally have 6 weeks, 2 months follow-up, and we normally do the X-ray to see how the spine surgery is doing. Normally, MRI is not required in most of the cases.
Right. And sir, after post-surgery care, what precautions should my uncle take, or what precautions regarding the wound should be taken?
Wound, I think we should avoid taking shower, or at least that area of surgery should be kept dry. It should heal in around 12 to 14 days. Once the wound sutures are removed, after 1 or 2 days you can take shower. That's one important thing, because we have to keep the wound dry for complete healing. And normal process, around 7 to 10 days the wound starts healing up nicely. So we give extra few days and then take the sutures out.
And sir, in terms of physiotherapy, recovery, walking, how important is that?
I think normal breathing exercises are very important for any surgery. They are good for circulation of your blood flow. Deep breathing always helps you in circulation. General stretching exercises are good for your overall body tone and posture. and walking or some amount of brisk walk is very useful for keeping you up and about, and you feel fresh, you feel you are getting better, and you are sorted for life.